As RSV cases continue to climb, many parents are wondering how to keep their children safe. Good evening. Thanks so much for joining us on this Friday. I'm Marcella Lee.
And I'm Carrie Lane in for Carlo Cicchetto. In just the past 3 weeks, 650 kids have tested positive for RSV at Rady Children's Hospital. Now, that doesn't include tests done elsewhere or those kids who were never even diagnosed. A lot of them may be wondering if there's any medication or a vaccine that can help either treat or prevent this respiratory virus.
CBS 8's Shannon Hanny has been working for you all day to find the answers to your questions tonight.
As of today, 56 kids are hospitalized here at Rady Children's with RSV. For the most part, they're getting oxygen and fluids to deal with symptoms. That's because there's no specific medication. There's no vaccine either. However, studies are underway in hopes of making both available.
It's a helpless process.
Yesterday, I shared the story of one father whose infant daughter, Ivy, was hospitalized for more than a week with respiratory syncytial virus, or RSV.
My wife and I were trading off 24-hour shifts. We spent a total of 8 days in the hospital.
Keith James told me Ivy was given airflow to help her breathe more easily. Beyond that, there was not much more doctors could do except monitor and give her time to heal, which she did. As a parent of 2 young girls myself, I wanted to know more about RSV, including treatment options. I did some research and learned by the age of 2, almost every child will get RSV. In most cases, it will appear as a common cold and go away on its own, though rest and fluids will help, as will over-the-counter drugs if your child is age appropriate. But for babies like Ivy, it can be more serious and lead to breathing issues, which is why she wound up in the hospital. As far as treatment goes, I turned to Dr. Davy Smith, the Chief of Infectious Diseases and Global Public Health at UC San Diego.
Is there a specific medication for RSV right now?
There's not an approved medication for RSV right now.
Dr. Smith says there are antivirals for RSV being investigated. In fact, Rady Children's is working with Pfizer on planning clinical trials, but a timeline hasn't been set. What about a vaccine? Researchers are trying to create one which some believe could be available in the next year or 2. I asked Dr. Smith, given how long RSV has been around, why don't we have a vaccine for it like we do for COVID, which is a new virus?
These are viruses that are not easy to make a vaccine for, COVID or RSV. And COVID was at a time when there was lots of people dying, so there was a lot of political will and money that was attached to getting those trials done very quickly.
So for now, though, what options do us worried parents have? When it comes to prevention, for starters, follow proper hygiene. Also, stay home if you're sick and stay away from others who may be too. If RSV turns into something else like a sinus infection, there is medication for that. There's also a drug to try and prevent severe RSV illness, but it's only for high-risk infants and kids and has to be administered before they get sick. For CBS 8, I'm Shannon Handy.
All right, Shannon, thank you.